Hello friends and Inform Scotland followers. I'm back. I was quite shocked when I looked at the website and I saw just how long it's been since I last updated the stats. So it's been 2 months. There's been a few reasons why I have taken this long. One is that after the school holidays started, when we all got COVID in this house and we had quite a miserable time, I felt terrible for my daughters and I was really keen to give them a nice summer. So I've been having a bit of a holiday. But I also was very aware while I was off, basically since I left, COVID cases were going through the roof. And to be honest, I was just so bored, really bored of the whole thing. And I started to just feel it was completely absurd, the whole situation. And I was totally and utterly scunnered, frankly. So I've updated the stats and I think because I've taken such a long break, and a lot of what I was doing was really just because it was the way I'd always done it. I am just going to approach it a little bit differently. So it's a bit more like a stream of consciousness blog that I've done today. You can see on the website, I'm just wondering if it's worth me. I don't think I can't turn the lens around, so you just have to watch me looking at the website. My phone is completely out of memory, so I can't do this film on my phone. You can see from the first graph that we are currently entering apparently our 5th wave of SARS-CoV-2. So we had the first wave last spring, and then we had a very peaceful summer, which was nice. And then we had our autumn wave, which was subsiding, and then we vaccinated a whole load of people. And in January, we had a massive rise in cases. And then this summer, for whatever reason, we have had a massive increase in cases. Now, what I would encourage you to do, looking at that first graph on the website, obviously I'm talking about the website informscotland.uk. I've put this post, because it's first in a while, on the general page and on the daily graphs page. So you can see that this surge that we've had in July is in sharp contrast to last July, where cases were completely flat. This is a coronavirus. We will be more susceptible in the winter, you would have thought. So frankly, I was quite amazed at this July surge when I was aware of it in the summertime. I didn't want to draw too much attention to it, frankly, for various reasons. So I just need to move because I'm actually covering my computer screen with my iPad there. Where are all these tests being done is what we explore in graph 2. And you can see from graph 2 that the pattern of NHS testing, so that's like staff, I believe, care home residents, stuff like that, has been following a very regular pattern really for quite a significant amount of time now. So that's not changed. But what we did see in July is a massive rise in community testing, which then subsided, and it seems to be rising again, which is probably a school testing effect. If you do more testing, you will find more positives. But obviously, if you have more people who are symptomatically ill, then you will do more testing. So it's hard to know, it's a sort of chicken and egg situation. I think it's probably a bit of both. The more community testing we do, the more positives we will get back, even if we had no COVID. But there obviously was something going on, and we all know that we knew people who got sick in the summertime. I keep saying this, I've been saying it for a year. I'll be saying it in another year. I have this horrible, horrible feeling. It doesn't matter how many positives you have if you're not seeing any problem in the hospital. The hospital is the measure of how ill people are getting. And what you see in graph 3 is that although we have had a distinct surge in hospitalizations, hospital occupancy of COVID patients in the summer, last summer we had nothing. This summer we've had quite a significant number of people in the hospital, but it's nothing like as bad as it was in January or indeed last autumn. I've presented 2 graphs about hospitalizations. What's quite interesting about graph 4, you can see that in the autumn, positive tests did predict a little bit what hospitalizations and ITU occupancy were going to be like. But we have now completely lost any relationship in this 5th wave. We have this, you can see in graph 4, this massive black spike of positive tests, and it's now rising again after subsiding very significantly. And ITU occupancy meanwhile is going down, and hospital occupancy is going down. We've had deaths this summer, which we didn't have last summer. I've put in graph 5 a graph of positivity. Now that only goes back to last autumn, so you can see the 4th wave emerging here on that graph, but that's the 5th wave overall. We are very much above 5% epidemic levels and have been for some time now, rising again, very different to what we saw last summer. I've put in a breakdown of the positivity by day. So we are seeing a very significantly obvious pattern of, at the start of the week, Monday, Tuesday, we always see higher positive percentage than we see at the end of the week, which personally I find quite strange. Well, Sunday, Monday, Tuesday are the high positivity days. We have been consistently well above the levels that we were seeing in autumn last year this summer, which is weird. Especially given the number of vaccinations that we have been doing. So, as we know, vaccinations are doing nothing to prevent infections. The data are really clear on this, and Daily Skeptic has been doing really good analysis on this. I can improve on that, so I suggest you go to their website to go and look at the analysis of it. Basically, we're doing nothing to prevent infections, but the argument is that we're reducing hospitalizations because, or the disease is less severe because we're reducing hospitalizations. But the trouble with that is that we're in the summertime, so we're comparing a winter wave of hospitalizations to a summer wave of hospitalizations, and I think really we're not going to be able to tell if the vaccine's reducing severity of disease until we have data from, like, to compare between similar seasons, because we know that coronaviruses are seasonal. Anyway, we have now vaccinated like 4 million people with 2 doses, and we're approaching 4 million with we're approaching 4 million having been vaccinated once, and the number of 2-dose vaccinations that have occurred is catching up to that. And when I broke that down, you can see that in graph 8, you can see that there's been a real lull in first doses delivered over the summer, and then there's been recently a wee hump, but it seems to be back down to those background summer levels, and second doses have remained at a kind of level, in a level state, and there's certainly more of them happening day by day than first doses. Then I have included, broken down by region, ITU occupancy with COVID, and what you can see is you can see waves 1, 2, 3, 4 in the hospital. The wave last year in spring 2020 was by far and away the biggest, and in terms of peak occupancy anyway. And then the graph looks very noisy because there's lots of traces in it, but you can see that we've had this wee noisy period on that graph over the summer where ITUs have been housing COVID patients or treating COVID patients. Again, it's not as many, and obviously we've got more positives. You can see that from the first graph. We have more positives now than we've ever had. This wave 5 looks like it might even be our biggest wave yet in terms of cases, in inverted commas. But our ITU occupancy has been the lowest, and lots of people are hailing that as a success. However, I think that really comparing this summer to last summer, it doesn't look good, and comparing, I mean, a lot of hospitals look similar in the autumn of 2020 to how they've looked in the summer of 2021. There is a mixed picture emerging here. Yes, we've vaccinated lots of people. As more and more people get infected as well, they will attain immunity, and there's no mystery there about any of that. If you are immune to SARS-CoV-2, you are immune, and that's it. We have no reason to believe that natural immunity doesn't last long. However, recently the Public Health England data, I think, shows that immunity is waning very much after 3 months. So in order really to get out of this epidemic or this pandemic, or I don't even know what we're calling it now, it's an endemic illness probably, but in order to achieve sort of herd immunity, people are probably one way or another going to have to get naturally infected. People are not ending up in hospital in large numbers, which is fantastic news. However, we have had hospital activity this summer, we had none last summer. And I think it's just, I am saying this because I feel very safe in saying it. It is frankly absurd to ignore that factor. And while I have been saying all along, and I continue to say, that there has been too much panic about this whole situation from the government, it is strange to me that they aren't panicking at all at this point, because, you know, the situation doesn't look that much better to me overall than it has at any other time. I don't really know what I'm saying to you, whether we should be worried or not. I don't think being worried about a virus is ever a good idea. But it's a kind of mixed story, and I'm very confused now at the story coming out of the governments that the vaccine works, but we still have to maintain our, you know, careful practices, and children are still wearing masks, which we know don't work in school. And, you know, the Spivey scientists have come out and said it was a behavioural control tool, it wasn't about preventing infections. I don't understand how this situation is remaining as it is. YouTube won't like what I've said here, but let's see if we can manage to keep this video up. Please do visit informscotland.uk. We are back on track. I've had my holiday. I'm feeling okay. A bit confused about what's going on, a bit tired of the whole thing. I think I am not alone in feeling that, but we will be putting more stuff up on the website, and actually this weekend I'm going to be sorting out some problems that we've had with the website, which is why I still don't have named Inform Scotland members on there. And if you have emailed us, I am very sorry if nobody's got back to you. We will be working through the emails in time. It's just that there's only so much that we can do. And I am not the most organised person in the world, but I have some more help with that on the Inform Scotland team. Thank you so much for your attention. Thank you for still watching this after my sojourn, and I'm very sorry that I have not been more attentive. Well, I'm not really that sorry, because I've been having a nice time, but I will be more attentive from now on. Stay tuned, stay sane, stay strong, and remember, I love you.